Hi everyone, I'm Dr. Tiffany Zugan and I'm a naturopathic doctor in the GTA. I currently practice in Burlington and Etobicoke, and I am now offering virtual appointments as a result of COVID as well. So if you're in any of those areas and you're looking for a naturopath, feel free to reach out. I run a general practice, which means I see patients of all ages with all health concerns, but generally I focus a lot on pain management, weight management, women's health, digestive health. So again, if you're looking for someone to support you with any of those things, feel free to connect with me. Today I want to talk about thyroid because it's been a hot topic in my practice lately, and I find that a lot of people either know too much about the thyroid or don't know anything about the thyroid, and really it is sort of a powerhouse in our body and it's responsible for a lot of what goes on with us. So I thought I would touch on some stuff about the thyroid today and help you learn a little bit more about your body. So there are sort of two ways you can go if your thyroid is not optimally balanced. We can go sort of an overactive route, which is called hyperthyroid, or we can go the underactive route, which is called hypothyroid. And the hypo or underactive thyroid tends to be what we see most often. It's commonly an autoimmune disease, although it doesn't have to be, but it is important to sort of get that stuff tested if you are pursuing any sort of treatment for your thyroid, because it is quite common, as I said. So be sure to double check with your health professional that you've had the antibodies checked to know if it's autoimmune or not, because that makes a huge difference in treatment. Now, to go back to sort of the basics, there's a lot of symptoms, as I said, because your thyroid is such a powerhouse in your body. There's so many symptoms that we can see that reflect the health of the thyroid, one way or another. So I'll just kind of run through those and what they mean really quickly so that you can identify if any of those are happening for you and, maybe if they're attributed to the thyroid or perhaps something else. So if we start from an underactive sort of hypothyroid point of view, generally people will experience quite a bit of fatigue, although that happens with hyperthyroid as well. Any issue with your thyroid, you're generally very tired. On the side of hypo, generally there's some weight gain. There's a slowing down of the metabolism because that's what our thyroid is really responsible for. Along with that sort of slowing of metabolism comes constipation. That's quite a common concern for people with thyroid conditions. Also, any sort of hair loss or hair thinning, which is a super common complaint from most people, I would say, that I see in my practice. Not necessarily that it's just because of your thyroid, but it definitely could be related. Also, if you have dry skin, brittle nails, anything sort of skin nail related, that could be thyroid too. Any sort of low mood or brain fog, we can also sometimes attribute to the thyroid. Muscle aches and pains, puffy, swollen sort of look to you. Again, those things can be caused by a lot of different things, but if you're noticing that a lot of these things are on this list are what you're experiencing and you have those as well, perhaps there's something going on with your thyroid that you want to check out. Now, on the opposite side of things, the hyperthyroid sort of side of things, again, tons of symptoms that can sort of reflect this happening. So in super severe cases or autoimmune cases of this, sometimes we see a true goiter, which means you'll get almost like a lump or enlargement in this sort of low throat area, which is where your thyroid sits. Again, that's called a goiter, and it means that there's something going on there to make that tissue grow. So you can look out for that. With hyperthyroid, we tend to see unintentional weight loss. So if you are sort of eating everything you want and not really exercising like crazy, and you're still dropping weight and you can't seem to keep it on, perhaps thyroid is something for you to look into. As I mentioned before, people with hyperthyroid are often very tired, just like the hypo side of things. We see a lot of anxiety, but again, we can see some low mood on that kind of side too. Often we'll see a tremor, which means almost like a bit of a shake in the hands. And another symptom of hyperthyroid that can occur is called exophthalmos, which is a very fancy medical word meaning that your eyes almost kind of bulge out a little bit. So that can be an indicator too that there's something overactive of your thyroid. Again, mood swings, nervousness, sensitivity to heat, these are also things that indicate there could be something going on with your thyroid. So now that you sort of know if you fit into a category or what category you fit into, let's go into the nitty-gritty about really how the thyroid hormones work, because that's how we identify what treatment route needs to be taken. So there's a part of your brain called the hypothalamus, and it's basically a hormone center for us. It's responsible for sending out a lot of our hormones in our body. So again, that's part of our brain, and as part of its responsibility is to sort of activate our thyroid to send out thyroid hormone when our body feels that it needs it. So the hormone that tells our thyroid from our brain to send out hormones is called TSH. Okay, now that's often what's tested by your medical doctor as like a screening exam for thyroid health. So it can indicate if there's anything major going on, either one way or another. Your TSH will be quite high if your thyroid is underactive, and your TSH will be quite low if your thyroid is overactive. So that's kind of step one in the hormone pathway. Once TSH is received by your thyroid, it spits out thyroid hormone. Now there's two forms. There is T3 and T4. Our thyroid spits out mostly T4 and a little bit of T3. And T3 is the one that's more active in our body. So it spits out a ton of T4 so that it can kind of get to the tissues like that. And once it gets to the tissues, it needs to be converted into T3 for it to actually have an effect. Now, again, in terms of testing that you've had with your medical doctor or anybody else, oftentimes they'll test the TSH, like I said. Sometimes they'll test your T4 as well. So that is sort of a general indicator if your thyroid is spitting out any hormone at all. The unfortunate part about running just these two tests is that we're really not seeing the active side of things in your body. As I mentioned, the T3 is what really does the work. So we need to know if your T3 is at a level that's productive for you. I've seen countless blood panels that have a really good TSH number, a really good T4 number, and their T3 is just plummeting. And it's like, no wonder you're experiencing these symptoms. And if that is the case for you, there's lots we can do to support you from a natural perspective to kind of get that conversion to be more effective or more productive, so that you really do get the clinical sort of symptom benefit versus just improving your hormone panel. So it's really important, as I said, to get that full panel tested, of course, with all of those antibodies I mentioned earlier too, because if it is autoimmune, again, that's going to change our treatment. So the last sort of piece of our hormone puzzle is something called reverse T3. So just to review, you have TSH coming from your brain that stimulates your thyroid. Once it receives that, your thyroid spits out T3 and T4. Now the last option is reverse T3. So T4 can either turn into T3 or reverse T3. And reverse T3 is very structurally similar but kind of opposite to our functional T3 molecule. It's very sort of sciencey and complicated, but really it is clinically relevant because when we have this reverse T3 molecule in higher amounts and maybe less of our active T3, we're not getting the benefits of the hormone, similar to if you weren't producing any at all. So reverse T3 can go up for many reasons, one of those being stress. So if you're very stressed and you've got some thyroid concerns, perhaps that's part of what's going on. But really the idea is to get that reverse T3 down to sort of a normal manageable level and have most of your conversion going into an appropriate amount of T3 so that you're getting, again, the symptom benefit of your thyroid. So hopefully this has been really productive and you're kind of understanding a bit better what's going on in your body. If you have questions about your thyroid, again, feel free to reach out or comment below, and maybe I can clarify some things for you. But again, I'm Dr. Tiffany Zugan. I'm a naturopathic doctor in the GTA, and I look forward to hearing from you.